it's good to be back with you on Health Options, the program that not only tracks government policies on health, but helps you with the information you need to make informed choices about your health. Thanks for joining us. I am Rabi Abdullah. Among the problems bedeviling the Nigerian health sector are poor primary health care system, high out-of-pocket health expenditure, poor maternal health, malnutrition, disease outbreaks, and inadequate human resource for health, which has now been made worse as a result of the disturbing increase in brain drain. Yes, the health sector is unarguably one of the worst hit by the Japa syndrome. In the course of his campaign for the occupancy of the nation's #1 seat, President Bola Tinubu highlighted in his manifestos what he intends to do to turn around the nation's health space, and this has in turn raised the hopes of many. Hope of speaking words to power that will translate to a public health system that works for all. On this episode of Health Options, we shall take a look at the task before the new administration in the health sector, taking the views of the implementers of the nation's health policies, experts, and other key players. If you're just joining us, this is Health Options, and we're taking a look at the task before President Bola Tinubu in the nation's health sector. Primary health care is the foundation of the national health system. It forms the entry point to healthcare service delivery that comprises of promotive, preventive, curative, and rehabilitative services. Let's join the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shaib, for insights.
I think there is no other direction than upwards for this administration, because the groundwork has been laid in terms of making sure, for example, that for the first time in the history of primary healthcare, we now have a comprehensive national database of what every state has in terms of the infrastructure of primary healthcare, in terms of the number of primary healthcare workers that exist, the kind of equipment, the kind of health management information system, the logistics, the laboratories, all of the information that they need to take decisive measures around transforming primary healthcare is now available in a comprehensive database. What is also awesome about this roadmap to transforming primary healthcare, this document, is that it is a document that is not just written by government. It is a document that has been signed off by our donors and partners as the roadmap, as the way to transform primary healthcare. It's taken a lot of years, a lot of negotiations, learning from the past, standing on the shoulders of people that have come before us, now pulling all of this together, articulating it in a way that is compelling, in a way that is motivational, to say, this is how you get it done. Whether it's health insurance, whether it is private sector involvement, whether it's the involvement of community-based organizations, what the governors need to do to get the job right. So we're very excited about what the future holds, because now we can see clearly that there is progress that is being made. So for the first time in the history of Nigeria, we have 8,000 primary healthcare centers enjoying on a quarterly basis right around 300,000 naira from the Basic Healthcare Provision Fund, making sure that they have resources to be able to maintain the services that are required in the health facilities. Some 25,000 primary healthcare centers across the country had never had this kind of steady inflow of resources. Now we're bringing them back to life. And it's not going to happen overnight that you see suddenly that you have a 5-star primary healthcare center. No, we're moving gradually but steadily towards a situation where you can move into a primary healthcare center and then you'll be glad, you'll be confident that you have the best treatment that you can. because of the quality of the human resources that are available. If 90% of our healthcare workers get the opportunity to leave Nigeria, they would leave. What will that leave us with? So we're marching steadily to a crisis in the health sector. When you go abroad, you find that in most of the competitive fields in health and human medicine, Nigerians are there. And a lot of those Nigerians want to come back. How can you engage with Nigerians in the diaspora so that there's an opportunity for them to come, even if it is once a year, to come and give back? How do you manage that process of people going abroad? Maybe they want to get additional qualification, additional skills. We shouldn't be discouraging people from doing that, but how do you manage it in such a way that you are also producing additional people, right? Such that you will not be at a deficit. How do you make sure that when they go, they also come back, right, over some period, right, to come and give back? And then also for those Nigerians, those medical personnel that are within the country, how do we improve their standard of living? We need to have that conversation so that you can also motivate people to work hard. Even for doctors, for the nurses, everybody who is working hard, how do you make sure that they can see that hard work pays? All of those things are conversations that we need to have. It is something that the administration needs to tackle. When you talk about maternal mortality, you have to look at a very broad spectrum of why do we have maternal mortality, why do we have under 5 mortality. They are what we call the key 4 delays of maternal death. The delay in taking the decision to go to a health facility, right, to seek skilled birth attendants. Even after that decision is taken, the delay to actually get there. It could be maybe transport, the logistics, distance, right? That is the second delay. The third delay is getting the right care when you get to a health facility. You can go to the health facility, and unfortunately, if you don't get the right care, it can lead to maternal mortality. The fourth delay is the delay in referring the woman to get superior care when the care is not available at the health facility that she has gone to. So when you look at all of these delays, you can easily link it up with the JAPA syndrome, which is to say, if you go, for example, to the health facility, that is the third delay, and you don't get the right treatment, the right management, of course that will not happen if you don't have the skilled health workers. And our skilled health workers are going abroad, the brain drain. And then when you go to the next level of care, the secondary healthcare facilities, the general hospitals, the tertiary hospitals, again, that is where you find that our doctors are leaving, our nurses are leaving. So the fourth delay is now being exacerbated because you will not get the right kind of care. So the JAPA syndrome is a serious problem that needs to be addressed yesterday. And addressing it yesterday means making concerted effort to understand the reasons, doing a proper assessment, consulting, negotiating, so that you come up with a result, an outcome that benefits everybody. But we have to think creatively about how to address this problem. It is not every problem that you address with force and muscle. It's about, sitting down and making people understand what your point of view, and then also listening to them so that they can tell you, what they are seeing from their side of the street. If you are on your side of the street, you cannot understand everything from the other side of the street. So you have to listen to them, and then bear in mind that the bottom line is we have one country, and everybody wants that country to make progress.
Universal health coverage means ensuring that everyone, no matter where they live or who they are, can access essential quality health services without facing financial hardship. It is estimated that over 70% of Nigerians pay for healthcare services out of pocket. The Director General of the National Health Insurance Authority, Professor Muhammad Nasir Sambo, tells us more about the Nigerian situation.
Since 1999 up to 2019, that is about 2 decades, the organization has been bedeviled by so many problems. I was appointed in the year 2019, specifically in July, to come and essentially stabilize the organization, refocus the organization, and also create innovations that will lead to attainment of the core mandate of this organization. It is interesting to note that because the health insurance is working in the area of financing healthcare, it is regarded as a key control knob for attainment of universal health coverage. So any country that you see you see a positive trajectory toward attainment of universal health coverage, there must be some kind of prepayment mechanism, that is a health insurance arrangement to guarantee that. So we unveiled the 3-point agenda the very day I assumed as a CEO, and we moved forward fast to deconstruct those agenda. Those pillars into various pillars. So those pillars became our guiding principle in our operations in the National Health Insurance. It is also important to underscore that when I was given appointment letter as a COO, there are 10 key deliverables that was handed to me. Almost all the facets of management process of the organizations. The first one has to do with value system. How do you change the value? How do you undertake value reorientation on the organization so that the staff, the crisis that emerge the organization will disappear? I want to say with all sense of responsibility, the National Health Insurance Authority now is one of the most stable organizations, because if you take a newspaper or if you visited your archives in your reporting, there was a time when every day NHIS will be mentioned, one crisis or the other. But for the past 4 years, those have disappeared into a thin air. So this is a major milestone that we have been able to achieve, stabilizing the organization. There are challenges that are within the operations and within the organization, internal challenges. There are external challenges. What are like the external challenges? We have been having a lot of challenges with Ministry of Finance. One, health insurance fund has to grow. And how can it grow? Through investment. You have an excess liquidity that you don't need it immediately. So you invest it and it grows. And when it grows, you now have ability to bring in more people because the fund has grown. You now have ability to expand the benefit package. So the Ministry of Finance, up till today, we have not received the approval to invest our residual money. So you keep your money is in TSA, and is depreciating by the day, and it's not bringing any additional value to you. This is a challenge. So what will be the agenda for the incoming administration? Number one, owing to the fact that the law of NHIA is now in place, and to help the administration in ensuring smooth sail at the level of National Health Insurance Authority, we established 3 committees. Number one committee is to review the guidelines, operational guideline of the National Health Insurance in line with the new Act. that committee has concluded its assignment. So the draft guideline is ready. So no need to start looking for anything. You utilize the guideline. Number two, we have set up a committee that will ensure the implementation of the mandatoriness of the health insurance. Because when you say health insurance is mandatory, how do you operationalize it? If I'm a private sector organization and I refuse to register my people, what will be the consequence? So we bring all the relevant stakeholders to look at all the laws and strategies that we can do to ensure that health insurance is mandatory. So all those ramifications, we are looking at them so that we produce a very comprehensive document that the new government will approve, and it now becomes binding to everybody. The third committee that is working is Committee on Innovative Financing. One of the major issue in Nigeria is resources are very scarce. But we have realized that countries that have gone far in a trajectory towards attainment of universal health coverage, they have created what they call innovative financing strategies. If you cast your mind back some years back, nobody was talking about this telecommunication industry. Nobody has envisaged, has ever thought that this industry will grow to the level that it can churn out a lot of resources. So, and the kind of innovative financing that we see in some countries is that when you make a call, 1 kobo per second call equivalent will be removed and put in as a health insurance levy. So through that, massive amount of resources can be generated, and those resources can be used for the vulnerable group. We have also seen in the Financial Act there's what is called SSB tax, sugar sweetened and beverage taxes. Those commodities or those food items that have capacity to trigger healthcare conditions are being taxed, and the appropriate place that those resources should go, I think, should come to health insurance so as to provide health protection to the generality of people. So if the government prioritize health, then all encumbrances that can militate against mobilization of resources for healthcare should be eliminated. When you take care of health challenges of your people and you reduce the out-of-pocket expenditure, you are indirectly lifting people out of poverty. So how can health be prioritized and be put on the topmost agenda? The new government should look at this document quickly and approve them and commence implementation, commence mobilization of the resources to cover the vulnerables. The framework for the implementation has been well elucidated in the state, by the creation of state health insurance agencies, by experimentation of this basic healthcare provision fund. What is it? What will it take? We know what is the premium that is required for an individual to get into the healthcare delivery system. So if the new government will look at the NHIA law, and be oriented on the various mechanism for bringing resources into the health insurance, especially through this health insurance levy that might come through the healthcare financing arrangement. Within no time, I foresee Nigeria moving in a right trajectory for attainment of universal health coverage by 2030. And mind you, one of the appealing features of the health insurance system is that the final destination of large chunk of the resources that has come to the national health insurance system is the hospitals. So through the funding that is coming through the national health insurance, hospitals can develop a strategic plan for development and improvement. As the monies are coming, they are using it to upgrade and expand the infrastructure and even hire more human resource for health, more infrastructure, more equipment, more human resource, and more better services.
The president, given his experiences, has already set up a committee that came up with an agenda in virtually all of the sectors, including health. And I'm so happy that from the statements he has really made, he is going to prioritize health. There are still a lot of challenges. While no matter how much you allocate for health, can never be enough, because the health sector is still not in the situation that we still want it, because a lot of Nigerians still go outside, for medical care. A lot of our hospitals here in Nigeria are not really functional. A lot of health workers, are migrating, to greener pasture. So the president needs to do a lot. The president needs to ensure that he prioritizes health. More money is allocated to the health sector. At least we want a situation whereby 10% of budgetary provision for health is made, for this health sector. Our Abuja Declaration of 2001 stipulated that 15% of the national budget must be allocated to health. This time around, in fact, this year we were able to get 6%. Our target is that for the next, within the next 4 years, the president should jack it up with the support of the legislature to at least 10% of our national budget. Secondly, whatever is allocated to the health sector must be released, cash-backed. So if this is really done and then replicated at the subnational level, that is the stress, I'm sure Nigerians, will have a better health system in the country.
Health is one place where whatever it is you do will be seen or not seen. But seen mostly because as long as children are able to access care, mothers are able to access care, nobody is dying, the numbers are going down in terms of mortality, and everything around health, human resource for health, things are working, it becomes clear that government is working, because we all smile. When people do not need to go and break the bank, when children stop dying, when mothers stop dying from very simple preventable diseases, when all those things, when the National Health Act is fully implemented such that every LGA, every ward, every community has primary healthcare center that works, when you are not afraid to fall sick because you know that the system will take care of you, then we will know that this government is working.
As a priority, both in the constitution and then in the way business is run. Health is wealth. Without good health, there is no socioeconomic development. Without good health, there is no peace. Without good health, there is no security. So my really ask to him is to really reposition health for it to become a real priority. We want health to benefit from the pro-health taxes, such as tax on sugar drink, on tobacco, and even other mechanisms. So health really need to be a priority, and with it, universal access to universal health coverage, but also better preparation to future pandemic under the new health emergency preparedness and resilience architecture. So this will be the ask, basically, and we need really stronger primary health care system structures and infrastructure and centers.
That's the much we can take on this episode. Join us next week, same time, for the continuation, where we shall interact with other key players, including ordinary Nigerians, on their expectations and views, where moving the nation's health sector is concerned. Do not forget to be a part of the program. You can watch these and past episodes on our YouTube channel. I am Wabi Abdullah. Thanks for watching. Until we come your way again, do take good care of your health.